Hey guys, good afternoon. Good afternoon, everybody. So, I know I didn't announce that I was going to go live, but I wanted to address a couple of questions actually. One of the reasons why I want to talk about this is because one of the most common questions that I see is, can I work in other states with my certification, with my medical assistant certification? And so, one of the things that I'm realizing is that some people don't know the difference between a nursing license and a medical assistant certification. So, guys, nurses, they have to be licensed. Well, let me just say this. Let me talk about, I can talk about nurses first. So, basically, when nurses, their programs are a lot different. They're actually in school getting a degree and they have to get clinical hours. So they take their class and then they have to apply to the nursing program in which they have to actually get clinical hours and things like that. And they have to actually get into the program, okay, versus getting into a medical assistant program. It's a little bit easier, right? Unless the school you go to has an entry exam, which is usually maybe like basic arithmetic, reading, writing, and math and things like that. And then some may offer the exam that where they want to test to make sure you are good with technology. But nurses are licensed in specific states. Okay, now I do believe that there is I don't know the name of it, but there's a license, there's a way. And if there's any nurses on here watching, if anybody's familiar with the name of the license, I forgot what it's called, but there is a way that they can get licensed in multiple states and not necessarily have to get license in every single state they want to work in, but this license covers them in multiple states. Okay. With that nursing license, they can only practice in the state that they for which they are licensed. Okay. When you have a certification, certifications are national. So if you get certified, and again, the programming is not as extensive as the nursing program, right? You get certified and you can go work, like I'm in DC, I can go work in Texas if I wanted to. Okay. So again, license are per state. You have to be licensed you can only work in the states for which you are licensed. And again, there is a license, like I mentioned, that covers you for multiple states. With certification is national. So you don't have to worry about moving from one state to another and worrying about whether you have to be certified in that state. Now, I will say this, since I've had this YouTube channel and I've been meeting a lot of you wonderful people from all over the place and, from the West Coast and just from everywhere, I have learned that there are some states that favor some certifications over the others. So if you happen to maybe move to California, I've just mentioned California because I've had sessions with people from California where the certification that they take is not CCMA, it's CCBMA. So that's the only other difference that I noticed, is that the certifications, the information is the same, but there are some states where, the certification may be a little different, and some states may favor some certifications over the other. But in general, license are per state, certifications are national. Okay. And the other question, what are CEUs? Now, this brings me now. I will say that the similarity between both a nursing license and a medical assistant certification is that they both require CEUs. CEUs are continuing education units. And why I wanted to address this, because somebody asked in a group, what are CEUs? And they said that they had just finished school and they didn't understand what CEUs were. And they said they had got their certification. Now, I'm going to tell you why this bothered me, because CEUs is something that you learn in your class from the very beginning, right? And so either the person that asked, they either weren't paying attention, or the school didn't do a good job, or the instructor, whoever, didn't explain that to the student, because you have to know what CEUs are, whether you're a nursing or medical assistant, whether you're getting a certification, because this is how you keep your license or your certification active. CEUs are continuing education units. These are requirements to keep your certification license active, because they want to see you continuing your education. They want to see you staying, staying on top of the new trends and healthcare changes. And healthcare things change, guidelines change, right? And so they require these to make sure that you're constantly educating yourself in the field. Okay. So when you get your certification, your medical assistant certification, you will be required to get your CEUs. Now, if you're taking the NHA CCMA, you need 10, and you can do them anytime between, when you want, and anytime during the time once you get certified until you get, you renew your certification. You cannot renew your certification without your CEUs. The great thing about the NHA is that it's available right on the site for you. All you have to do is watch some videos, read some articles, answer some questions, and literally each article or each lesson is worth 2 CEUs. So all you have to do is 5 if you do the ones that's worth two credits, okay? But you need 10 every 2 years. So that's that. I wanted to answer that, and I wanted to see if you guys had any questions. I do see a couple questions. Hey, Fancy. Hey, Andrew. What's that, Andrew? Are you still here? What is that that you're posting? I'm not sure what that means. Hey, Fancy. She says, I've been studying for the NHA instead of the should I find new study material? Take my So you say you've been studying NHA instead of, I'm not quite clear on your question, Fancy. I see you fixed it and said NHA, but I'm not sure. I've been studying. It seems like you're saying you've been studying for one test, but you're taking another. Should I find new study material? And that you take your test on Sunday. So let me know what you mean, Fancy, and I'll come back to that. Hey, Alondra, I'm glad you love the videos. You're welcome, Tanisha. It's a recertification every 2 years. Yes. So Georgia, if you are taking the CCMA or the CMAA, those certifications are every 2 years, and you need 10 CEUs. If you are talking about the RMA, that certification is every 3 years. And the CEU, how many? I think you, don't quote me, I can't remember. It's on a video I did, but that's every 3 years. And then the CMA, the certification is every 5 years, and you need 60. Was it? Yeah, I think 60 CEUs for the for the 5-year certification. Oh, so you're taking this. Oh, you're taking the CMA through the AAMA, and you were studying. Oh, I see what you're saying. You've been studying. Oh, wow. Okay, I see what you're saying. So this is the thing, Fancy. A lot of the information is the same. Okay, the foundational information, terminology, things like that, anatomy, EKG placement, administrative questions about appointment types and things like that. Those things are the same. They don't change from certification to certification. So you're fine with that foundational stuff, but there are some things that may be on the CMA that's not on the NHA exams. So if you've only been studying the CCMA information, you may be missing out on something that you need to know for the CMA. So I would, if you can, get the study guide in the meantime. I know it's Wednesday, you're taking your test Sunday. If you cannot, Fancy, I would still take the test and see, because like I said, a lot of the information is the same. So I would still go for it. And in the meantime, if you're not able to buy the study material for the CMA, then at least, try Smarter MA, try that website, try, if you're in my Facebook group, the Medical Assistant Lounge, try searching the file section. Okay. You said you're a CCMA. I'm confused why I'm taking. Fancy. Yeah, you shouldn't have to take the CMA. Are you applying somewhere that's asking you to go back and take that test? So she says, I'm a CCMA. I'm confused why I'm taking the CMA. Yeah, I'm confused too, Fancy. Are you already a CCMA and trying to get a job that's requiring you to get the requiring you to also be certified in CMA? Hey, Tori, I'm glad you're here. Yeah, let me know. I'll wait for you to comment that, Fancy, but I'm gonna go to this next question and I'll come back to that. Because I'll just say this, once you have one certification, you shouldn't need another one unless you are trying to work somewhere that favors that certification. I'm getting certified. I think they scheduled me for the wrong test. You said I'm a CCMA. So So you never been certified. Okay, so if you never been certified, Fancy, you're not a CCMA. You probably went to school for medical assistant and finished, but if you never got certified, you're not a CCMA unless you took that exam and passed. Now, let me address this because this is one thing that I do see with some of you guys, not necessarily you, Fancy. I don't know because I don't know all of your situation yet, but some people, they think that once they finish medical assistant school, they are a CCMA or a CMA because the class includes that in their title. But just remember, guys, you're not a certified medical assistant or certified clinical medical assistant or registered medical assistant until you take those exams and pass it. Once you finish your program, you complete that program, you are a medical assistant, but you're not certified until you take that exam, okay? And some people get confused between the certificate and the certification. Let me address that too while I'm here. When you finish your program, you are a medical assistant and you get a certificate of completion, okay? That shows you finished the program. That's a certificate of completion. The certification is the actual exam. So no, Fancy, you don't have to do CMA at all. All you need to do is take your exam. You don't have to do, if you're scheduled for an exam on Sunday and you're scheduled for the CMA, just take that exam. You don't have to, you either take one or the other. So if you want to do the CMA on Sunday and you pass it, you don't have to worry about NHA at all. You don't, once you take that exam, you don't have to worry about any other exams. Once you take it and you pass it, that's it. I've also had some people asking, do I need to go get, I'm already an RMA. Should I get certified in CCMA as well? You don't need both. So does your school allow you to choose, Fancy? Are you taking this test through your school? If you're taking this test through your school, then no, you don't choose. You take the test that they are administering. The only people that choose is if the school gives you a choice. So if the school says you can take this, my former school, we gave them the option of taking the RMA, and we said you can take that or you can take the CCMA. Now, if your school is only offering the CMA, then that's what you take. If your school is only offering the CCMA, that's what you take. If they're offering, what else did I say? CMA, RMA, whatever your school is offering, that's what you take. The only people that can choose is people that had been out of school for a while. They've been working and they just want to go get certified. Okay, so you graduated 13 years ago. Okay, yeah. So in that case, you choose. So just stick with the test you already have scheduled for. You already paid for, right, Fancy? Just stick with the test you have scheduled for Sunday. Let me go back up. I saw a question from Maisha. I'll come back to you in a second, Fancy. Maisha says, what's the difference between the CMA and CCMA? Maisha, they're both certifications for medical assistant. The CMA is a 5-year certification, and that is administered by the oh my goodness, American Association of Medical Assistants. They are the ones that give that exam. The CCMA is a 2-year certification, and that is given by the National Health Careers Association. So 2 different organizations. One is 2 years, one is 5 years. There's other differences, which I have a video on my channel. But it's too detailed, too much to try to explain all of it here. So that's why I did a video breaking down the differences. But that's the biggest difference: the amount of years and the organizations that give those certification. But they're both certifications. Yeah. So yep. So Fancy, you just go ahead and take your test on Sunday, and let me know how you do. I'm gonna be waiting for you to let me know. And then in the meantime, you can just start, check out Smarter MA. They have a free version. You don't have to buy the paid version if you don't want to. You can just do as much of the free version as you can. Okay. And then if you're able to buy that study material, then I would do that. All right. So let's see. Touche says, I'm currently studying for the CCMA and I wanted to know if you could do a video specifically about clinical patient care. I keep having trouble with that on my practice test. So Touche, I do have a video on patient intake, and I have some vital sign videos. Now, as far as doing a video on clinical patient care for the test, the only thing that I can do is when I do more practice test questions, that's the only way, because there's really no way to do a video about clinical patient care besides what I've already done, which is the patient intake and the vital signs. The only other thing that I can do is some example questions that you may see on the test, which I'll eventually get back to when I'm able to do some more practice tests. Yeah, those clinical questions like how to assist with certain procedures, those scenario questions, you will see those, and I'll do more of those once I have some time to create those slides. A lot goes into, so guys, this should let you know I haven't had time to do those slides. A lot goes into creating those slides because it takes me hours to create them. And so I haven't had time. I'm working on a study guide, an online study guide. So I haven't had time. I want to focus on that. When I have hours to spare, I'd rather work on that for now. And then later I'll be able to come back to those study session videos. Catherine says, what's the opinion of the CCMA certification? I'm guessing she means then you don't have to go to school. You just have to have experience for. So I do know, yes, the CCMA exam does have the option of getting certified if you have the relevant experience. So I did talk to someone booked a session with me who does not have a medical assistant certificate. However, she's been working in this office for over 10 years doing medical assistant work. It just happens that she got hired there and she was, front desk at first, and then they started letting her work in the back, and she pretty much just had on-the-job training. So in that case, yes, if you have the experience of a medical assistant and you've been working, I think NHA, you got to look on NHA. It was either 3 years or 5 years. If you have that relevant experience, NHA does allow you to take the CCMA certification. Yes. Only with the relevant experience, because I get some people wanting to take the test with no experience. In that case, no, you have to have gone to school for medical assistant, or you have to have worked as a medical assistant, done some of the same duties. Let me see. Claudine says, please, I need to take the state exam for MA. Can you send a review for me? So two things. The medical assistant certification is not a state exam. So I know you guys, I see a lot of people in the group saying state exam. It's not a state exam. This is the purpose of me doing this video, to remind you guys that certifications are national. They're not state exams. I see that so much, and I'm a literal person. So when I'll be honest with you guys, I kind of get caught up sometimes when I see things that are incorrect, because to some people they might say, what's the big deal? It's still an exam. No, it's not a state exam, because it's different. A state exam is an exam for that state to be certified or licensed in that state. Certification exams for medical assistants are national exams, and I don't have a review to send you, but I have videos on my channel you can check out. So you're here on my channel. All you have to do is look at the playlist. You'll see CCMA playlist, and those videos also help if you're taking the RMA or the CMA, but you do have to get that study material as well. So yeah, so just remember, guys, certifications, just to kind of recap, the reason why I wanted to do this video was just to remind you guys that certifications are national. Okay, we are not licensed. It's not a medical assistant license. I do see some people say that. I got my medical assistant license, or I'm trying to get my medical assistant license, or I'm taking my I'm taking my boards. We don't take boards. Nurses take the board exam, the licensing exam. We don't take any boards. We take a certification exam, and it's national. It's not a state exam. I just want to remind you guys of the correct terminology, because I don't want you guys to be confused. Now, medical assistants can get an associate's degree in medical assistant. Now, some people want to know whether they should do that. I think you should do that if you want to use medical assistant as a stepping stone into nursing. That is a good thing to get, because then if your credits are transferable, then you can easily move into your next, your next program, whether it's nursing or, sonography, or, or even becoming a physician, or PA. It'll help. You just have to make sure, if you do go get your associate's degree in medical assistant, that you check with the school to make sure that those credits are transferable. And I'll tell you guys this. I'm going to tell you what happened to me. And this wasn't for medical assistant. This was when I went to go get my psychology degree. I didn't realize, I went to University of Phoenix online. I didn't realize that a lot of colleges did not take those credits. So I was not able to transfer those credits. So make sure, first of all, that the credits are transferable, and make sure that the school you want to go to next will accept those credits. So 2 steps. Make sure they're transferable, which the school that you're going to, they're going to tell you they are, because they want you to come to their school. Okay. Those recruiters, they're going to say, yeah, you can go to any school you want. Make sure, if I want to go to this next school to finish my degree, or I want to go here. Let's say, you want to become a nurse, right? And so I'll use DC for an example. So we have a few colleges. We have Howard. We have GW, George Washington. We have Georgetown. We have Trinity. Now, Trinity is very common for my medical assistants to go to for nursing. So if okay, I want to go to Trinity, just using Trinity as an example. I want to get my associate's degree in medical assistant. Before I go to this school for my medical assistant degree, let me call Trinity to make sure they accept those credits. So don't make the same mistake I did. I went to University of Phoenix online, and I did not realize that the school that I wanted to go to finish my psychology degree. So I got my associate's degree, and I said, well, for the bachelor's program, I want to go to this other school, okay, in person in my city. None of the schools would accept those degrees, would accept those credits. So I had to continue on in my bachelor's program at the University of Phoenix, which I didn't finish. I still have to finish my bachelor's. I got the associate's, but I have to finish the bachelor's. But I just shared that to say that I wanted to go online. I wanted to go in person. And because I couldn't transfer them, I had to just continue online, which is part of the reason why I did not complete the bachelor's program, because I needed in person. So don't let that happen to you. So if you want to get your medical assistant, if you want to get an associate's degree in medical assistant, again, make sure you can actually use those credits. And it's good if you want to further your education. And if you're someone and you're like, look, I don't want to do anything else but medical assistant, especially if you're older, and okay, I've been doing this one job, I just want a new career, all I want to do is medical assistant, then you may say, I don't need the degree. But if you're young, fresh out of school, or early 20s, and you're trying to figure it out, just go ahead and get the degree, because it's going to help you out if you ever want to, like I said, further your education. And then let's say you want to teach. Some of you guys, anybody here watching now, a medical assistant, and maybe want to teach one day, you want to become a medical instructor like myself, let me know if there's anybody here that's watching that's interested in it. If one day you want to teach, right, that's going to look good if you want to teach, because when I was at my former school, they ended up making me a lead instructor, because I think I was the only one that had a degree. And so that helped out with that. Okay, Fred said he's interested in one day teaching. I love that, Fred. Are you in school, or you already working as a medical assistant? Some of my students even know they want to teach one day. So if you want to teach one day, that helps. If, like I said, you want to further your education, it will set you apart. I will say that. It will definitely set you apart. Oh, wait a minute. Somebody said they passed. Congratulations, G. Congratulations. G says, hello, Miss K. Oh, she said Queen of CC. Oh, my goodness, G. You want to make me cry. She said, I can't thank you enough. Your videos have helped me learn so much. I passed my NHA CCMA. You're a true gift. G, you are so welcome. Oh my goodness, that just made me a little emotional. I want to do a video, guys. I want to be a little bit more transparent with you guys. I'm not going to do that here, but I'm going to want to just do a video that I haven't done on my channel yet, just to kind of talk to you guys about some things. Because G, you have no idea how much that just touched my heart. You have no idea. Linda says, Miss K, if I didn't finish an externship due to car accident and surgery, oh, I'm sorry to hear. The externship I attended was full of issues. Can I petition to get credits and diploma? So that depends on your program, Linda. If your program requires an externship to get your diploma, then no, there's nothing you can do about it. Even though the externship has issues, unfortunately, that happens more often than people realize. You just have to, hopefully everything's going well after your accident and surgery. You'll just have to resume your externship when you can and request another site. That's the only thing you can do. If your school does not require the externship, then yes, you can just simply, take your certification. But some schools, you have to have the externship to get your diploma. If that's the case, then you have to just do it. I've had several students who have had externships that were not great, and either they, stuck it out, or if it was so bad that they couldn't take it, they requested a new site. And some externship sites we actually had to let go. We had to break out contract with because they were not treating the students right. They either had them working outside of their scope. Maybe some sites were rude to the students. We've had some bad sites. So it happens. You just have to, if anything you can petition for, that would be a new site, but you can't petition for a diploma if they require that. Lori says, I love being a medical assistant. I've been a medical assistant for 27. Wow, Lori, have you ever thought about teaching? And congratulations. I see you said you took it on 20. Okay, in 2020. Still, congratulations. It's been a while, but congratulations. 27 years. Wow. Are common prescribed meds on the CCMA? Yes. So any of the certification, you may see commonly prescribed medications because you have to know classification of drugs. Now, it's hard to say how much of it you need to know because it's so random. So you might have to know, they might ask you what is an antiemetic, which is for nausea. They may want you to know, antihistamine, which is for allergies, or antibiotic for infections. So you need to know those medication classifications, and you may need to know some common medications. For an example, I've seen Cipro on the practice test, which is for urinary tract infections. You do have to know that Coumadin or warfarin is a blood thinner. So certain things like that, yeah. And it's on the study guide. Anything that's on the study guide can be on the test. Oh, okay. Fred says, I'm still a medical assistant now in the LVN, a licensed vocational nurse. Okay. But wanting to get the RMA for teaching and rest. Oh, okay. The certification with the RMA for teaching. Oh, yes. Yeah, go for it. He said, why not? Yes, go for it. That is amazing. So you're still a medical assistant and now a licensed vocational nurse. That is amazing. What school offers a CCMA? Ooh, that's a loaded question, Fran. All you have to do is look in your area and search medical assistant schools in your area. Lori says, I went to school in 1995 and graduated in 97 with an associate's degree. Congratulations. I didn't even know they had medical assistant associate degrees back then. I thought that when I first heard of an associate's degree in medical assistant is when I started working at my very first school back in 2011. We offered an associate's program. So up until then, I never knew it was possible until then, because we had always talked about just a certification. Nobody ever really talked about an associate's degree. So it wasn't talked about. Even now, I'm sure there's some people watching now. Anybody here finding out for the first time that you can get an associate's degree in medical assistant? There's so many people that don't know. Somebody posted in my group on Facebook about their degree, and people were commenting, you don't have a degree, You don't get degrees in medical assistant. And I had to correct them, like, you absolutely can get a degree in medical assistant. But the reason why they said that is because they didn't know. They thought the person had it. They thought the person was mistaken, but the person actually was in school to get her associate's degree. So a lot of people don't know that. But you absolutely can. Now, Lori, I'm just learning today that it's been around that long. I didn't know that. I thought it was new. You're welcome, Linda. Ms. K, can you tell me what the difference between externship and clinical experience? Yeah, externship is a part of your curriculum. That is when you get your hands-on experience. And clinical experience is just any experience in the office, in the doctor's office. So your externship is clinical experience. So externship is your hours. That's like your hours that you got to work for free. But don't look at it like that. Don't look at it as you're working for free. That's why I'm doing the quotation marks. You're really just getting your hours. You have to get that hands-on experience. And with nurses, they do clinicals. Their version of an externship is clinicals, that where they have to go into different specialties and they have to work and get that experience. So I don't know if maybe my luck if you were asking about that, but yeah, clinical experience is just any experience working in the clinical area, like taking vitals, blood, injections, anything clinical. And your externship does count. Oh, one thing I want to add, guys, for those of you who are trying to find a job and all you had was your externship, you know that externship is experience. So you have experience. Even though it was only maybe 4 to 6 weeks, you have experience. Okay, so don't think you don't have experience. You have experience. And after you complete your externship, add those things to your resume. Everything you learned in school should be on your clinical section and on your resume. Everything you did on externship should be on your resume. And your resume is a standing document, meaning you constantly add to it. Every time somebody has you do something new on your job, add it. My former job, the office, I still worked at PRN, but when I was there full time, they had me doing some administrative stuff. Guess what I did? Every time they had me do something new on the administrative side, they got me balancing ledgers. Oh, I'm accepting pay. Oh, I'm adding that. Processing credit payments, check payments. Oh, I'm adding that. Anything that you learn on externship, add it. Your resume should have clinical skills on it anyway, guys. Everything you learn in school should be on your resume under your skills. Externship at your job, and I recommend uploading your externship to your Google. I'm sorry, not externship. Sorry. I recommend uploading your resume to your Google Docs, to your Google Drive, so that way you can pull it up anywhere and you can constantly add to it. Because one of the worst things is when your computer dies or your computer crashes and you can't get to your resume and important documents. So any important documents uploaded to your Google Drive. Okay. Oh, not 2020. Oh, okay. I got you, Lori. Okay. Just like, congratulations. Okay. It said 2020. Okay. Congratulations, Lori. Maricela, I hope I'm saying your name right. She said, I got my MA 2023 watching your videos. Thank you so much. You are so welcome, Maricela. G says, thank you, everyone. And Ms. K, you were made for the, thank you. Do you know about travel, May or mobile? And no, I'm guessing you're asking about MA jobs. No, if there's anybody here that has information about travel, I'm guessing you're saying mobile travel MAs. I don't know if that's a typo or if that is actual. If I'm just not familiar with that May or mobile. Let me know if you mean travel medical assistant or if that's a typo or if that's the actual job you're asking about, because I've never seen that, G. But I was going to say, if there's anybody who has information about travel MA positions and you're in my medical assistant group, the medical assistant lounge, please share that information. Every day somebody's asking, and I'm actually thinking about it as well. One thing I want to tell you guys too, while you're on here, if you are in school, or maybe you're not in school, but you maybe still can contact your school. If you can, so I do sessions with this school in Texas where their students will schedule sessions with me. If you want to refer me to your school, and just, these students referred me to their school. So now, like I said, I do these sessions. So if anybody wants to do that and just kind of let them know, they can contact me. They can send their students my way and pay for those sessions for the students. That would be great, because that's what that school does in Texas. And it's called Uncharted Territory, LLC. If anybody's looking for an online medical office school, it's called Uncharted Territory, LLC. If you are in Texas, they do have a hybrid option for medical assistant. So you can check them out. Great school. The owner is very nice. I've met him. And so what he does, he pays for the sessions for his students. So if anybody want to recommend me to your school, I'm also, my daughter graduated high school. She's about to go to college in the fall. I have some free time where I can get on the road. So I'm thinking about some travel MA jobs, and I'm thinking about some travel medical assistant instructor jobs as well. So I'm open to that as well. Yep, Smarter MA helped a lot of people. Dorsha says, I heard Smarter MA and my videos help. Yes, Smarter MA. I finally checked it out because so many people were talking about it. And when I did, I can see why so many people love that website, because you can do so much for free. And then if you want, you can buy the paid version. So I love it. I'm actually creating a study guide that is similar to that. It won't be it won't be like theirs, put it like that. It's just going to be very basic with some videos and some practice questions and stuff like that. Glad to know that, Lori. Marini says medical assistant jobs are not easy. It can be stressful and very demanding, but kudos to those that does it. Yeah, Marini, you are right. It can be stressful. You are right. It can be very demanding depending on how many patients you have a day. And that's why I like to be real with people. Like, you can really, really have some busy days. I've had some days where I was just so tired and I was just worn down. I mean, and that's in the medical field in general. Even the nurses are, especially during the pandemic, they were so overwhelmed, and so many people not showing up and quitting, and it can be very stressful. I love it though. That's why you have to have a heart for it. When you have a heart for it, it's stressful, but you love it. Like, guys, think about some things that stress you out, but you're not going to stop. Like, it stresses you out, but you love it. That's how it is for me for medical assistant. Even though I don't work in the office full time, I just go when they need me and I'm available, I'll go. And those days it gets stressful, but it's like, I love it. Teaching is stressful. Teaching is demanding. My work goes home with me. That's one thing to be prepared for, Fred. If you do decide to become an instructor, your work literally goes home, because you are, during class time, you have to teach. And then after work, you got to work on stuff for class, so you just have to love it. So if there's anybody watching this and you're thinking about medical assistant, you have to love people. You have to love healthcare. You have to love medicine. Okay, Lori says, I've thought about teaching as well. Oh, I wanted the degree program, but wasn't. Okay, got you. Wasn't available around you. Got you, Fred. Okay, radiology, perfect. I have quite a few students who have gone on to radiology after doing medical assistant. Tori says, yes, Lori, do it. Touche says, it's crazy how much you don't get to learn about the field of MA in school and from the instructors. Yeah, it does depend on the school, Touche. It does depend on the school and the instructors, because, some schools, they do. I've had sessions with people where they said they felt like the school just threw them out there and they didn't get any help. And, it's sad to hear. And then some online programs, you're kind of on your own. That's why I like online programs where you have an instructor available and they're hybrid. So you can go in for your clinical skills and you have a live instructor helping you. Oh, you had 180 hours, Lori? Oh, okay. My former school was 160. Yeah, so it varies. Externship can vary anywhere from as little as 80 hours. There are some schools that only do 80 hours. It could be anywhere from 80 hours, 100, 120, 140, 160, 180. I think 180 is the most I've heard. You're welcome, Lori. Hey, cute one. She says, Miss K, it's my first time catching you live. A cute one. I love that name. I'm glad you're here. Oh, she said, yes, travel medicals. Okay, that's what I thought. That's what I thought you meant. So yeah, if anybody has information about travel medical assistant positions, please, if you're in my medical assistant group, the medical assistant lounge, post some information about that because so many people are interested. I'm actually, you know what? I just got an idea. I'm not even going to say that on here, but I just actually literally got an idea. My last day is tomorrow. I take my final, Britt. That's Britt. Okay, you take your exam on March 18th. Britt, we wish you the best on your exam. Make sure you are studying. Make sure you have that practice test and study guide, and that your life is revolving around your test those few days up into your test. But not too much, though. Don't stress yourself out. But I'd rather you be into it too much than not enough, because some people don't study at all. But I don't want you to stress yourself out either. But you got this, Britt. Muggy Puff said, this is my first live. Welcome, Muggy. I'm glad y'all are making it. Lori is in McKinney, Texas. Okay. NHA website is very good. I agree, Maricela. I love it. They provide everything for you. And then the CEUs are free. Now, some certifications you have to pay for the CEUs, but they are right there. They are included. When you pay for your certification, you get your CEUs and you have to pay to recertify, but you don't have to pay anything extra for the CEUs. So I love them. She says, yes, I love the 40 questions and giving explanations. She's talking about Smarter MA. Yes. So Smarter MA, they give you that free practice test. You get 40 questions and they explain why the answer was incorrect. You are right about that. Studying for the C. Okay, so you're taking Q1 is taking a CMAA exam. Okay, make sure you are, I got some CMAA videos on my page, Q1. So make sure you're looking at those. And if you don't already have the study guide and practice test, make sure you have those. And if you do have the study guide and the practice test, I don't know if you've taken any of your practice tests yet, but just make sure you focus on your areas where you fall short. Don't spend too much time on what you already know. Okay. Make sure you are studying those things you don't know, and make sure you are those appointments, Q1, the appointments, your make sure you know AOB, EOB, COB, those things, your accounting portion. Some people avoid that because they don't like the thought of numbers and math and all of that. It's not a lot of math, but make sure don't avoid those areas. Your terminology, even though it's not a clinical exam, you do have to know terminology and some anatomy. And then, like I said, just make sure you're taking a practice test and double down on studying your weak areas. Okay, Muggy Puff is taking a CMA. Same to you. Make sure you're studying. You have the practice test and study guide. Ramirez says, do medical assistants do a lot of administrative tasks? It depends. So administrative medical assistants, yes, they do everything administrative. If you're a clinical medical assistant, you may do some of both. So you'll do primarily clinical, and then depending on where you work, especially if you're in a private office, you'll be doing some of both. So if you want to work somewhere and not to do a lot of administrative tasks, you are better off working at a bigger company, because big companies, they have somebody for everything, and they don't even want medical assistants doing anything administrative. So if you don't want to do anything administrative, just you may want to avoid private practices. That's not to say that every private practices you'll do a lot, but those tend to be the offices where you have more autonomy, you're doing more, you plan more than one role, you wear more than one hat, whereas in the bigger company, they have usually somebody for everything. Yep, Lori, it's stressful, but I love it. Yep. I've been an MA for 2 months now. Okay, Muggy. Oh, yours were okay. So, wow, 200 hours? I don't think I've ever heard of an externship being 200. The most I heard was 180. Wow. How long did it take you to complete that, Muggy? Is it Muggle? Oh, I'm sorry. I thought that was an I. That's an L. I'll just call you Puff. You're welcome, cute one. I love that name. Dream Caddy says, been an MA for 2 years now. Awesome. Can you work as a CTMA if you are not good at typing? Yeah, you can. You can work as a CTMA if you're not good at typing. I know some people that can't type well. Now, if you're working on EHR and you got to get that information in, it is going to slow you down. There are some free typing classes that I recommend to some of my students that can't type. If you just, I can't think of any names right now, but if you just Google free typing class, that'll help you. Because if you're working with EHR and you got patients, a bunch of patients, you need to be able to get that stuff in there and keep it moving. Now, if you're on the administrative side and can't type, that's going to be a really big hindrance, because when you're on the administrative side, you're at the computer pretty much all day making appointments. You may even have to type up letters. There's a lot of typing, but if you're on the clinical side, maybe not so much. Tori is saying good luck to you guys that's taking your test. Lori says, I started when I was 16. My doctor let me. Oh, wow. Lori says she started when she was 16. Her doctor let her work in his office and paid for school. Lori, that is amazing. Wow. Do you have any info on HESI A2 exam? No, I don't, Dream. Sorry. I'm not familiar with that. I got my NHA study guide in December 13th, started studying on the 14th until it was time. Okay. You cut everyone off. Oh, Lori says she cut everyone off when she was studying. Sometimes you have to do that, especially listen, guys, you got to know your triggers. If you know you the type, if your phone rings, you want to answer, that means you need to put your phone on do not disturb. Muggle said it took about 3 months. Oh, for 200 hours? Yeah, that's a lot. Wow. Wow. But I'm glad you got it done. Okay, guys, let me know if you have any other questions. I'm going to get ready to end this. I'm just going to put my link up there for anybody that maybe wants to. Oh, you know what? Let me put this up here because I'm doing let me actually put this up here for anybody. I'm doing a group study session on March 16th. I've done 2 so far in this virtual. 317. What is that? Is that 316? I'm sorry. 316. At 11 a.m. Eastern Standard Time. I've done 2, and somebody asked me, am I going to be doing this every month? I cannot do it every month, but so you guys can go to bookwithmissk.com and schedule it. So group study session, the way we do it is basically people, they schedule to come on, and I ask anything you want to go over, whether it's preparing for the test, because it's a tutoring session as well. And let me also add that it's a tutoring session, so that way it's not just for the exam. So even if you're not yet taking the exam and you're in school and you just need help, you can join too. You don't have to be necessarily already about to take the test. So it's a tutoring session. Resume, cover letter help, anything you need help with, any questions you have, join that session. It's $19.99. I wanted to make it as cheap as possible, and it's for 2 hours. So we get on, I answer anything you need, go over whatever you want to go over, and then I go through the foundational stuff you need to know for your test. So Lori says, when I was taking the test, it wasn't a lot of medical term or phlebotomy. It was more administrative. Yeah. So yeah, you're right. All exams are different. You're right, Lori. Every test is different. It's hard to say. Like, you all can be sitting beside each other right now taking the same test, but every single test is going to be different. Oh no, Muggle. She said, oh, wait a minute. Muggle said, I'm sorry, Muggle. I can't tell if Muggle is a male or female. I can't see. But Muggle says my test is on the 14th, so I'll have done it by then. I'm sorry. Wow. I'm so sorry. There's one-on-one options as well at bookwithmissk.com as well. So if you want to do a session, you can. My videos are enough, to be honest, guys. The sessions are just for people that need some more one-on-one time. But the videos and your study guide and practice tests are enough. So I don't try to push my stuff on you guys. I don't want to make anybody think you have to buy anything. I don't want to be one of those type of YouTubers that's always trying to sell something, but I started making myself available when people started requesting these sessions. People were like, can I call you? Can we get on Zoom? I will pay you. And so when people kept saying that, literally every day on my YouTube, somebody is asking that, I started offering the sessions, and they are really cheap. I want to make sure people can afford them because I know people are in school. People tell me my prices should be more. I will never charge $99 for no session ever. When I create my study guide, I'm even going to make that priced fairly and affordable. Now, if I was to sell something for $99, it would be because it's big. It's like let's say I did a 6 months access to my online study guide. Something like that would maybe be, but for a 30-minute session, I would never do that. I know some people who do that, but I can't do that. People are in school, so I want it to be affordable. Oh, Fred said I missed the other study session. Yeah, I decided to do another one because people were asking, and I have the time. I'm not doing nothing on that day, so why not? All right, guys. Do you guys have any other questions? Thank you, Lori. Lori says you're a great teacher. Your students should pass their exams. So, Lori, I've had in my current school for my classes, I've had a 100% pass rate since 2019 until not this semester that just passed, but the semester before last. I had 100% pass rate. Now it's like 90 something. Every single student would pass their exam until one class I got, which is fine. You know, I had a student, I think it was 2 students in that class. It was a big class too, and 2 of them did not pass. But for the most part, all my students passed. Thank you, Muggle. That's why I tell my students, I'm like, listen, when I get new students, I'm like, listen, guys, do what I'm telling you to do. Everybody passes. I'm like, listen, just do it. One of my old students came in here today and was talking to my current students. She was up here visiting, and every time one of my old students come visit, I have them talk to my current students. And she told them, listen, do whatever she says, just do it. Q1 says, what do you suggest for someone who has exam anxiety? I get it. I get this question a lot. So it's so layered to that because I know it's easier said than done, but you really do have to kind of relax, and you really have to kind of try not to overthink and second guess yourself too much, Q1, because it's going to make it worse. And you almost got to kind of, just tell yourself, I got this. Like, remember, like, have somebody quiz you and make sure you can answer open-ended questions. And if you can, you got this. And you just got to tell yourself, I got this. I know what I'm doing. I got this. Because exam anxiety is real. Some of my students have it. And it's really just about trying to, because the more you, and again, I don't want anybody to think I'm minimizing it. I'm not. I'm just telling you guys what I know that you really do. If you can try to relax, it makes so much difference, because part of the worry is what causes you to clam up and second guess yourself. I had a student who had test anxiety, but she would always get good grades on her tests. But it was because she started practicing relaxation techniques, and that's what would help her. But when she allowed it to overcome her, it was like she just started picking anything just to be done with it. And Q1, flag your questions that are difficult, that you need to take more time on, and do your easy questions first. So that way your 3 hours, that's going to go by quickly. It sounds like a lot, but it's not. Those 3 hours going to go by quickly. So just get through the easy questions first. So that way you will have done enough. So let's just say you've been taking a while and your test cuts off. At least you've done enough to where you still pass. I've had students with anxiety. I had 2 that I can think of that took their entire 3 hours and the test cut off on them. But guess what? They passed because they had already done enough and got enough correct answers, because they flagged the hard ones, got through the easy ones, and came back to the hard ones. Okay. Can we go over how to present to the provider? I appreciate all your videos. Let me add that, how to present. That's a good question, Carla. Let me add that to my notes here. How to present to the provider. I'll mention something real quick, but I'm going to add that how to present to the provider. That's a good one. Present to the provider. I'll just tell you right offhand, Carla, you want to be, of course, be willing to help. So our job as medical assistants is to make the job easier. So we do want to, of course, appear. We want to present, enthusiastic and ready to learn. Like, what do you need? Just let me know, and I got you. You know what I mean? You just want to be eager to learn. Take initiative as well. Dr. Jackson, would you like for me to do this? This patient is here. Do you want me to go ahead and before he even put the order in, Dr. Jackson, this patient has already told me she has chest pain. You want me to go ahead and do the EKG or whatever, because some doctors, you need the order first, but with some doctors, they'll say, oh yeah, go ahead. Let me put the order in real quick, before they even go in there and see the patient. So just take initiative and let them know you're enthusiastic about helping, right? Be assertive, not aggressive, but assertive. Just be assertive and be confident in yourself. And, some newer medical assistants, they get really scared around doctors because when you're growing up, especially if you're not used to being around doctors or lawyers or, officers, people in these powerful positions, you kind of get, you feel intimidated. A lot of new medical assistants feel that way, and I get it because I remember feeling that way. But you just kind of have to be assertive and just be confident in yourself and in your skills and just be ready to work, really. And I'll do a video on that. I just made a note of it. So that's a really good question. I'll think more about it and take some notes on it. And I'll do a more detailed video on that because that's a really good question. So Q1, Muggle says take breaks. Pomodoro method is very helpful. Thank you, Tori. Lori says I have it also. I relaxed. You're welcome, Q1. They said as long as you get above 80, you passed. Yeah, so for the CCMA, you got to have a 390 out of 500. And that is 78%. So 78% you pass on the practice exams. So my students, they have to get an 80% on the practice exam before we even let them take the test. Because if you can get at least an 80, then we can be confident that you can get at least a 78% on the test. During my externship, when one of the doctors remembered my name and I wanted to cry, oh, you felt seen. That's what it was. You felt seen. Yeah. So the doctor remembered your name and yes, that's what that was. You felt seen. And you got some great doctors that, it's the best when you can get out there and work with a doctor that's just fun to work with. They respect you. They appreciate you. I remember one of my doctors, I've had some pretty good doctors. I haven't had any real bad experiences. I had one bad experience, and this particular doctor was like this with everyone. And I'll tell you guys about that next. Let me get back. Let me talk to you about the good ones first, and then I'll tell you about that experience. But I've had so many good doctors, guys, and I mean like in the positions where I was that doctor's MA, because you have some offices where you all work with the doctor, and you have some offices where this is your doctor you're assigned to. Like some doctors, like, if it was my birthday, like they would get me a gift or give me like a gift card, or, buy lunch for you, sometimes buy lunch for the whole office. Like you do have some really, Christmas time, they'll give you bonuses. You do have some really good doctors out there, like that really appreciate you and they show their appreciation. Now, the other side to that, which I was going to mention, you do have some doctors, and this isn't any profession where you'll have someone that you're working alongside or working under that may try to be aggressive and try to, assert their dominance and things like that. But when we had that particular doctor that was like that, and they had kind of told me already that that particular doctor was like that, I had never seen it. And they were just saying he was very rude and he would, he has made people cry and all of that. And I had never seen that side. And then it actually was a couple years before I even seen that side. And I had to tell him, I said, listen, I said, I am here to do my job and I am nothing but respectful to you. Please respect me. I'm an adult just like you are. And I said some other things too. I can't remember exactly what I said, but I basically let him know that as long as you respect me, I'll respect you. He ended up apologizing and he bought the office lunch. Sometimes you do have some instances where you may have to stand up for yourself, and that's with any job really, because some of you guys may work somewhere where you may have a rude manager, right? And just as an adult, I need respect just like I'm going to respect you. And so, but hopefully you get a good doctor like the ones I've had. Like I said, that was just that isolated incident, but for the most part, they have been great. Mogul says, my provider and I have the same personality and sense of humor. So it's been an awesome 2 months. I love it. Listen, when you can get a great doctor and have fun and laugh, that is the best, especially if it's a private office. They will literally take care of you. One of my doctors, we're still friends to this day. I worked with her in at one of the companies I worked for. I was there from 2006 to 2010, and I had a few different doctors during that time, but the one that I was with the longest, I would go to her house. She had like 4 kids. She would have birthday parties. I would go to her house. She came to my house. Like, she was the best. And to this day, we are still friends. And I stopped working with her back in 2010. And we are still friends. Like, that is the best. Yeah, it is. That is the best. Lori says, I worked for a doctor for 10 years. And when I left to move here, that doctor begged me to stay. Just 2 years ago, he moved to Texas and called me, asked me, really? Wow. Lori had a doctor follow her to Texas. Wow, that is amazing, Tori. That is so cool. Yes, that is the best when you can just, and especially once you know what he or she wants, it's like you already know what to do with certain patients. You know what she wants or he wants, and it's beautiful. So I pray that for all of you guys on here that's about to get into the field. I hope and pray that you can have a wonderful experience with a wonderful doctor. And if you happen to run across a provider, whether it's a doctor, nurse practitioner, or PA, that does not treat you well, don't be afraid to speak up for yourself in a respectful manner. But I pray that you guys don't have to go through that, because it's a beautiful thing when you can go to work and love what you do and love the people you work with and that you work for. But he was not happy about the doctor he was working with. Bedside manner is a big factor with him, so he left. Wow. Hey, Hamza. All right, guys. So it's been an hour. I did not expect to be on here this long. Thank you guys for tuning in today. I'm still at my job, but my students, they left at 1 or 1:30. So they've been gone. I just decided to go ahead to get on live and answer some questions. Hamza said my test is on March 18th. I'm so nervous. That is normal to be nervous, Hamza. I hope you are studying. I hope you have the study material. As you can see on the screen, I am having a studying session on the 16th at 11 a.m. Eastern Standard Time. So if you want to join that, you can go to bookmsk.com. Let me see what else. Let me make sure I don't have anything else to announce to you guys before I get off here. So I did tell you guys, if your school is willing to work with me, let me know if they want me to do study sessions with their students that they're willing to pay for. Also, if anybody is on here and needs a proctor, I know some of these schools are requiring that you have a proctor. I am open to doing that for you. Let me know. Depending on where you are, I will come and be your proctor. What else? The study sessions. I have the group one on Saturday the 16th, but I also do one-on-ones. You can schedule there. What else? Anything else, I will announce it. You're welcome, Tori. You're welcome. And it was nice to finally meet you. I actually did a study session with Tori the other night, and it was so nice to finally meet her, because Tori is one of my regulars. She's always online when I go live. And so it was just very nice to meet you virtually, Tori. I know you're nervous. It's okay. You're going to be fine. We're going to get through this. We're going to pass this test. We're going to finish this class, and we're going to pass this test. So you got this, Tori. Muggle says, good luck to everyone else taking a test. We will do amazing. Yes, you will. You're welcome, Lori. You have a blessed day as well. You guys be blessed. If I think of anything else, I will announce it and I may go live possibly tomorrow. We'll see. But you guys have a great day.